And we will we'll have a few questions, and I'd like to ask our speakers to come up to the table. And also there's going to be the big draw for the big prize from the foundation, which we'll do just before Hakan does his final remarks. Can we wait? We'll have the question period and then we'll do the draw. That's great. So don't leave. What if you win? Okay. If you have more questions, there's still people collecting. The first question is for Dean, and there's actually two questions here. One, how can someone take the Drive Able test? And two, is driving cessation all or nothing, or is there research on safety of, quotes, restricted driving?
The first question regards how can you take it. Well, there are some private places, the occupational therapists that do perform the Drive Able for a fee, but I believe it's about $300 or $400. We are actually somewhat fortunate in BC that the Motor Vehicles Department does pay for it. They don't pay that much. They obviously have a discounted rate. But in Ontario, for example, you have to pay for the privilege of having your license revoked, whereas at least here it's currently still covered. But there are some ones that you can be referred by your doctor to have the Drive Able performed. The other question related to what was the second question again?
Is ceasing driving all or
nothing? All or nothing, yes. Unfortunately, it does tend to be an all or nothing decision. We obviously advise our patients who we still feel are capable of driving to restrict to local areas, daytime hours, good weather, as long as you're feeling well as well. Those are normal restrictions that we recommend. But it turns out that most accidents do occur close to home. So most accidents occur within a kilometer or two of home. So in fact, just restricting to a local area doesn't seem to make a difference in terms of accident rates.
There's a question here related to autopsy studies, and the person is saying that my wife is now dying with end-stage Alzheimer's disease. What Alzheimer's studies are most enlightening to better understanding her history and what the situation is? Robin, would you like to answer that? Or Dean?
I'm sorry to hear that. But if it's a patient that we have been following, and then we can arrange for an autopsy. Because actually, when we do research, it's not just having the brain tissue that is important, but it's having the whole series of assessment throughout the life that is most important. Sometimes we do still find unexpected things during an autopsy, for instance, those mixed dementia. So they may have some Alzheimer's pathology, but they also have some strokes or Lewy body. And we cannot tell easily just by looking at the patient, and we need the brain to tell that. So if it's a patient who has been followed in our clinic, then come to talk to one of us and we'll arrange that. But if it's not our patient, it's not really very useful for us just to collect brains. If the patient has not been seen by a specialist with a series of testing and follow-up, then we don't really know what's been happening through that person throughout the life. Then I'm sorry, but that's not really very useful to us.
Thank you. There are a couple of questions here I'm going to try and combine because they're related to recommendations. And we have had recommendations related to, for example, exercise. We've heard something about nutrition. But maybe our panel could make their primary recommendations in terms of, there's so many options in terms of plant-based diet, animal-based food. We've heard some compromises that people can consider. What about your blood pressure, etc.? And then there's a whole backside of all of this because they've been thinking about all of it. But also, people are really looking at, okay, what should I take home? And what are the recommendations for me to do the best I can to minimize my risk or improve my quality of life, and that covers everything.
Well, maybe I'll start. Generally, anything that's good for your heart is good for your brain. So we know a lot about heart health. So controlling risk factors for vascular disease, such as high blood pressure, diabetes, cholesterol, all those things apply to the brain as well. Because we know that anything that contributes to the vascular disease burden in the brain actually makes the risk of dementia higher. And that's particularly important in midlife. So midlife will define as sort of 40 through 70-ish. How about that? The data on that for people who are in later life is less clear. The other important thing, of course, is, as Robin alluded to, is the Mediterranean diet and those components. That's as good as we know. Most of the supplements don't seem to have much validity to them, such as omega-3s don't work, whereas the natural sources of fish oils do. And as well, exercise, as you heard from Teresa, that's also a very important part of prevention as you age.
So basically, Dean said most of it. I think it's mostly in moderation. We talk about wine and coffee. I probably wouldn't suggest excessive, but a small amount. For the guidance recommended for male, wine is about 2 to 3 glasses a day and no more than 15 per week. And for women, it's about 1 to 2 glasses per day and no more than 10 per week, just because they're smaller. So those are very specific guidance, but there's really no real no big range that you can control yourself in. But it's mostly eat healthy and exercise regularly. As long as you try to do that, you're already decreasing any type of disease, not just dementia, but also heart disease and cancer. So exercise and eat healthy is just a general recommendation.
Well, thank you. I think these are topics that could continue on for a long way before you go home and have your yogurt and red wine. At any rate, for Julie Robillard, there's a question related to tracking devices. And I guess, for example, we're talking about iPhone and GPS or something of that nature, and how you get the right one. On my phone, I can measure my steps, for example. But also there's a question about when will ALBA be available?
Well, let me answer the one about ALBA first. As soon as possible, pending funding and testing, essentially. So we have some preliminary data with ALBA. We're doing great progress. We're going to present some of these data at the upcoming International Conference on Artificial Intelligence, which is next week in San Francisco. So ALBA is well underway, but not quite yet ready, which is why I raised your awareness about the 6 criteria, so that in the meantime, you can play ALBA. The other question was about tracking devices. So your phone and various commercially available GPS tracking devices can be helpful in situations where you have wandering. They can be a terrific tool. There are important ethical implications around using tracking devices. You think about autonomy and privacy. So it's important that when we're considering the use of devices like that we have an open discussion, that we talk about what this means for the person who's going to use it, for the care team, for the family. So they can be useful if they're used properly, if they're done with consent, and if there's an open discussion. And if I'm not mistaken, there's tools from the society. So I'm going to pass it over to Maria to complete the answer.
There certainly is information on the Alzheimer Society websites about a number of different tools. I think it also highlights the real necessity to have discussions early on with the person who has a diagnosis about what their preference would be if that would happen, because that goes a long way to consent and the ethical issues about trying to have safety.
Maria, while you have the microphone, The question is related to dementia-friendly communities. Can more be done for protection of persons with dementia, particularly to minimize or prevent such as financial abuse?
It's a great question, and certainly that is a significant concern, and it's one of the elements of the dementia-friendly community, and working very closely with financial institutions and the legal associations who sometimes see this before other people do to understand what their role is. We also work very closely with the Public Trustee's Office to really think about, again, how policies and practice can be put into place. It is a very hard subject, but certainly having the right people in the community who are aware and can pick up signs and know how to deal with it is the first step.
Thank you very much. I think we do have a couple more questions, but I think in the interest of our time, we're going to have a draw for the prize from the UBC Hospital and VGH Foundation. So would you do that, please? Did you want to mention a bit about the foundation? You have 1 minute.
Hi, everybody. My name's Taya Beck, and I'm a fundraiser with VGH and UBC Hospital Foundation. Thanks to everybody who stopped by our booth during the break to say hi and to enter our draw. It was really nice to meet everyone. You may not know that we raise funds not only for VGH and UBC Hospital, but also for GF Strong Rehabilitation Centre, the Vancouver Coastal Health Research Institute, and for Select Vancouver Community Health Services. We also work with donors to support patient care and research at CARD, the Clinic for Alzheimer's Disease and Related Dementias. And we're very proud to be partnering with RBC to help make today's Alzheimer Update event possible. So thank you to RBC. If you are interested in donating to CARD, or if you have questions about giving, I invite you to come see me back at the booth after we're finished the program here today. I'm happy to chat. You can also visit our website at vghfoundation.ca.